Hello, and welcome to the Owensboro Health University of Louisville Family Medicine Residency. We regret we can't meet with you in person and give you the tour, but we hope this video will help you decide if this is a good residency for you. Thanks for considering us, and now listen to what the first ever residents of this program have to say.
When I came down here, I was really intrigued by how devoted Dr. Savorabong and the other faculty seemed to the program. You could really tell that they really wanted to make it work and they really wanted us to choose it. And that means a lot because when you're going through a whole bunch of residency interviews and you feel like you're kind of rank and file after a while, that you're just on a long assembly line, a conveyor belt for attendees. And it really didn't feel like that.
I also was impressed by the hospital, which is fairly new and state-of-the-art, as well as the health park here and pretty much the city of Owensboro. For a small town, it had quite a bit to do, even during a pandemic.
It's an area that's underserved. Medical needs around here are very high, and I could tell that when I first arrived here that this was a place that was desperate for doctors. And that's good in a way because it provides a wonderful learning opportunity to see patients who really need medical care. And Owensboro Health is dedicated towards providing that level of care, which I saw they were really passionate about when I was interviewing here. Another reason why I came here is this program offers an opportunity for full spectrum care, which means that I get to help patients at all stages of life, whether they're a newborn all the way up to the very end in palliative care. And that's a unique opportunity that a lot of programs don't really offer you because you're usually competing with other residents or the program is situated in a way that isn't really geared to serve towards those factors. Owensboro was kind of unique in the fact that they were stressing that as being a critical component to why we're going to be educated here and what we would look forward to.
I've always kind of loved working at the outpatient clinic. Just a great deal of patient population, a great deal of pathology, also a bunch of complex case management, chronic case management. If you're interested in diabetes or hypertension or managing metabolic syndrome or chronic pain or whatnot, this is an excellent residency for you. But you also see a lot more atypical things, and there's also a lot of opportunity to do procedures.
I did only 3 rotations so far, but I feel like I learned a lot about our community and hospital. The interaction between us and staff members and patients was very beneficial during the inpatient service, in my opinion, because now you get to do a teamwork. So we try to provide the best care for the patients, and we all have to work together, including patients.
Well, we've learned how to manage patients with heart failure, with atrial fib, history of MI, learning about various medications that improve mortality in those patients. Especially I've learned to interpret some nuclear scans, various imaging.
You see everything from A to Z, with patient coming to ER with pain in his belly, what the doctor does, what he order, and then you see him in the OR, what surgery he has done, and then you follow up post-op with him. And this is great, yeah.
My rotation in Louisville was a unique experience, but I feel very formative in Norton Children's Hospital, where I was at, has a lot of patients with pretty severe diseases and higher acuity than you would see in a smaller town, mainly because the sickest of the sick patients are referred to larger cities. There I could see children that were born with pretty severe diseases and how they were managed through both medical treatment and surgery. And there were some diseases I don't think I would have seen in my entire career had I not gone to Norton Children's.
We have a continuity clinic, so every week I'm still here in the family medicine clinic seeing patients. Some patients that I've acquired through my time in the ER or my time in the hospital. They were patients that I had in those environments who have wanted to come back and see me in the clinic, and it's nice to be able to say, yeah, here, look me up, my name, and you can make an appointment with me, and I'm there every week, so that there's always an appointment available to come see me.
We are some of the first residents to go through the program, so we have the opportunity to shape the culture for generations to come. And one thing all of my co-residents and I have in common is that we want to create a culture that is non-competitive but cooperative where we don't have the same toxicity that you see in other residencies around the country, where we help each other, where we don't throw each other under the bus, and where we try to create this environment that fosters learning and achievement and excellence.
They're all very knowledgeable. They all have a different approach and different experiences, which they are they bring to their teaching and their styles. And they talk about private practice and academic practice and hospitalist practice versus clinic practice. But so much experience and so many stories, so many learning points that they bring forward. I've enjoyed working with all of them. They're very good.
Well, what I appreciate the most is the faculty and the other my fellow residents are a really good group of people. Very nice to be around. We're very pleasant and we're good to work with. Everyone's been super helpful in terms of if I have a question or I want to run something by someone. Everyone's really welcoming and offers great suggestions, and I'm happy that we have a good camaraderie amongst ourselves.
It's just a great environment to work at. I learn a lot. I feel like I'm challenged without being overwhelmed. I know that they're there for me if I ever really need help and feel like I'm drowning and I need someone to show me what to do or take a bit of the slack.
The Health Park gym is one of the best gyms I've seen in this state, and we get free access to it. You don't have to pay for parking, don't have to pay for lunch. It's really nice. The health park actually had a vast diversity of equipment, free weights, benches, and different sub-programs and routines that you would see for all kinds of different gym goers, from cardio to heavy lifting to Tai Chi. And there are also programs that I can refer my patients to for physical therapy, fall prevention, and cardiac rehab, all under the same roof.
I think Owensboro is a pretty great town. And I don't say this half-heartedly. I've lived in a lot of places, and what makes Owensboro stand apart is just the level of community here. The patients and the people I meet out there are simply amazing. They care about you, they care about their health, they're engaged with you, they invite you over for meals, they'll constantly cook for you.
Well, I mean, so barbecue, I grew up here, and Owensboro barbecue is still, in my opinion, one of the best barbecues around. There's a lot of public outdoor spaces, which is nice. I have little kids, and so being able to go down to the river, to the park, or the various parks around, it's just, again, a nice, safe place to be able to let your kids sort of run free and run around. So, yeah, definitely enjoy that outdoor environment here. You still kind of have those personal connections that I feel like in bigger cities you may miss. So that the commute is non-existent. It's 5 to 10 minutes across town. You can be anywhere in town, which is certainly nice when you're working long hours and wanting to get home and see your family. I don't have to worry about parking or traffic and that, which is a big benefit as well too. So overall, yeah, it's a great city to grow up in, great city to raise a family in. Very safe, very, like I said, very friendly, and very welcoming.
So Owensboro is kind of like, it's a confluence of a bunch of different rural regions. We're like one of the only big hospitals for a whole bunch of counties in this area, actually, and it kind of shows. There's a little bit of everything here, you know, but you also get a great kind of a pseudo city life too. The downtown is smaller than most downtowns, of course, but there's a lot of fun things to look at and do. There's really good restaurants. There's lots of places to shop. And it's really kind of beautiful in terms of just city structure and agriculture. You have the river right there in the gorgeous river park.
When I came to Western Kentucky, I was kind of surprised. I heard people talking up a town, and I figured, well, that's just what you do. You're being polite. You don't want to say this is a horrible place, and you want to sell it well. But it turned out that was true, and that's what I found to be unbelievable, but at the same time refreshing. So it was a hidden gem of being able to come to this program.
When you're interviewing for residency programs, you can kind of tell from the onset whether or not they want you to succeed, and by that they mean whether or not they actually care about you and how you succeed. And I feel like this would be a place that would both care about the work we do as well as the people doing the work. And I have no regrets. I was right. I'm very content here. I'm very happy.